Life in Kigali City's busy commercial center is almost back to normal less than a week after our total lockdown was lifted. And for those who make a living working in places like the Nyarugenge market, getting vaccinated is proving very beneficial indeed. The vaccine has helped us because our customers have far more confidence that we will not make them sick. And even if the virus was to be transmitted, you would not get as sick as a person who has not been vaccinated. That is why almost all of the vendors in the market have been vaccinated with the first jab and are waiting for the second. We are happy because after we have all been vaccinated, they will stop closing the market. We are now operating at close to 30%, and after we have all been vaccinated, we will be able to work as we used to before. Hairstylists and barbers have also been vaccinated. We have taken the first jab of the vaccine and are waiting for the second. All of the people who work here so that things can go back to the way they used to be. We did it voluntarily because we understand that it is for our own benefit and all Rwandans. Many people make a living the way I do, working for wages, and you burn through your meager savings very quickly whenever a lockdown is enforced. The vaccine will allow us to go back to working the way we used to. It will allow us to work confidently, not afraid that we might go back into the lockdown again. Almost half of all eligible people for the vaccine in Kigali City have now been vaccinated, and 10% in the entire country. I believe that you realize that most of the cases were in Kigali City when infections spiked, and that this is usually the case in urban areas because of the movements of people. Also, most people coming from abroad usually end up in cities and towns spreading the virus. The fact that the vaccination program has focused on urban areas is therefore key. We must also remember that the objective is to protect people enough to allow businesses to resume operations at full capacity, and most are found in urban areas. Vaccinating people in urban areas therefore allows for the biggest number of people to be protected and for businesses to recover. Indeed, at this pace, life could go back to normal sooner than most realize.
Close
to half of people in urban areas supposed to be vaccinated have gotten the vaccine, and we are at 10% countrywide. That is just in the past month. I cannot specify dates, but at this rate, the fact that vaccines have continued to arrive, and in places like Kigali, almost all people over the age of 40 have now been vaccinated, and soon we should be able to do the same even in the provinces and among people in younger age groups in their 30s and 20s. I believe we will begin 2022 with many people vaccinated. Even if a few remain without the vaccine, it will not stop life from returning to normal. Despite the confidence, health officials are still urging people to respect the COVID-19 preventive measures in place, regardless of whether or not they are vaccinated.